here on behalf of the AIDS Healthcare Foundation. I'd like to stipulate it at first. We think this is a great device, and it's been very effective, and the inventors of it have given you a good overview of how effective it's been. This bill is not about the device. This is about who is going to be using the device on the patient. Our concern dealing with the population when their acuity of their disease can be, the change in delivery of care can be harmful to them. We're very concerned about who's actually using the device at the time the patient is being cared for. There are concerns about having a phlebotomist have to deal with ruptures in an artery, ruptures in the catheter itself, air in the catheter itself. If you don't have a nurse standing right there or doing it, then you run the risk of the patient having an acute episode and nobody there in the moments after to actually deal with the problem. Talking about people with HIV, this is a big issue for our folks who are in hospital, and for those reasons we're opposed to this bill. Thank you.
Thank you very much.
Chair and member of the committee, this is Curtis Lang Jr. with the California Nurses Association, representing over 100,000 registered nurses who are opposed to AB 822. As Mr. Rand just stated, I must state that as a patient advocate, CNA is not opposed to this advancement in technology, which minimizes patient needle sticks. However, we do oppose the use of unlicensed, inadequately trained phlebotomists to access indwelling IVs for the purpose of withdrawing blood from patients receiving infusion therapy. This procedure is beyond the scope of a phlebotomist and poses a threat to the health and safety of hospitalized patients. Current education requirements do not prepare phlebotomists for the care and management of peripherally inserted intravenous catheters. As the proponents mentioned, the starting, stopping, flushing, evaluating, and restarting of IVs is the responsibility of the direct care registered nurse. So why do we need this legislation? Nurses are already using this technology to minimize patient needle sticks. It doesn't make sense to have a registered nurse start an IV line, evaluate the IV line, stop and flush the line, then have the phlebotomist attach a catheter to the line, draw the blood, then have the registered nurse flush and restart the line if needed. This is a disruption of workflow, which pulls the nurse away from other patients that need nursing care when the nurse can just use the new device her or himself. This is a single source bill sponsored by a company that wants to put these devices in the hands of more hospital personnel for increased sales and profit. These devices should be used by licensed and adequately educated professionals. Patient safety is more important than increased profits. For all these reasons, we respectfully ask for your no vote on AB 822.
Thank you very much. And your affiliation again?
California Nurses Association.
Thank you very much. Additional witnesses wishing to speak in opposition.
Mr. Chair and members, Matt Brown on behalf of the Teamsters and the engineers and scientists. In opposition, we represent nurses and share Mr. Lang's concerns. Thank you.
Thelma Harris, Chief of Legislation for California Board of Registered Nursing. We represent over 450,000 registered nurses, and we do oppose.
Thank you, Mr. Chair. Members, Mitch Steiger with the California Labor Federation, also in opposition.
Thank you very much. Any additional witnesses wishing to speak in opposition? Seeing no additional witnesses in opposition, any questions or comments from committee members at this time? Seeing none, there's been a motion and second. Committee Secretary, please call the roll.
8822, motions do pass as amended to appropriations. Lowe.
Aye.
Lowe, aye. Bro aye. Bloom. Chen aye. Chu. Cunningham. Dolly aye. Eggman aye. Fong. Gibson aye. Gloria. Grayson. Holden. Irwin aye. McCarty. Medina. Mullen aye. Obernolte. Quirk-Silva aye. Ting aye.
That bill has 10 votes. We'll leave the roll open for additional members.